Okay, it's 6:30, let's call the Sawyer County Public Service meeting to order.
Yes, sir.
Roll call
Dale Schluter,
here.
Tweed Schuman,
Yes, ma'am.
Dale Olson, Chuck Van Etten,
Here.
Don Pettit,
Here.
Lorraine Gouget,
Here.
Jennifer Verbornik, Carol Pearson,
Yeah.
Dr. Sabrina Dunlap.
Yep, here.
Okay, certification of compliance with open meeting laws.
The meeting has been noticed to the public and news media as required by section 19.84 of the Wisconsin statutes.
The meeting agenda. Any changes or? Okay, we'll keep moving. Public comments. Anybody from the public who wishes to speak?
I do have one. Hi, Linda.
Good evening, Linda Zilmer, resident of the town of Edgewater. I have two issues tonight that I would like to address the committee. First one is an agenda item, and the second one is about feeling safe in the county buildings. The first agenda matter is having to do with the continuation and cost of providing water testing under Sawyer County's being the agent of the state. For some members of the board who weren't here in 2018, I really think that it was questionable that the county thought that this would either be self-sustaining or generate revenue. It's also a duplication of many water testing services that are available to the public already. And so if the committee is thinking of recommending eliminating water testing and limiting the water tests that it does and charging more money than other available testing avenues that we have, I have to question the need to continue it. I sent an email to Administrator Hoff that shows that under UW Stevens Point, I can send my homeowner's kit to them and have it processed for $55, and then also know that my data can be available on the statewide water quality viewer. So with regard to the benefit of better water quality in Sawyer County, I haven't seen where it's been taken to that next step of what are we seeing with water quality in Sawyer County, and what is the county doing about it that's any better for the public than just having routine samples done through the other available labs. And the second item I'd like to address the committee on is feeling safe in being able to come to the county building. I really appreciate the efforts that the county and its staff have gone through to make virtual attendance at meetings a possibility. That is greatly appreciated, but there are some things that you need to come to the courthouse for. So I did need to come to the courthouse last week, and I was very concerned in overhearing employees talking about one person not feeling well, suspecting that they may have COVID, undecided as to whether they were going to have a test. And I thought the county had a policy about if you're not feeling well to stay home. And so I had a short amount of business to take care of. However, the county's also in the process right now of having the public review of a couple of very large plans that you can't really absorb online. The average person can't print out hundreds of pages or compare the old version of the Land and Water Conservation Plan or the Forest Plan or the Outdoor Recreation Plan to the new one. So I feel my ability to come into the courthouse to view those documents, I really don't want to be there if there's a question of, are we following common sense, whether it's the law or not? And as in yesterday's meeting of Economic Development and Extension, a committee chair did not wear a mask. Another supervisor did not wear a mask. A member of the public did not wear a mask. And in the assembly room, you guys can't really socially distance. Now, the public generally has an opportunity to attend virtually, but that committee requested the presence of a member of an outside organization to attend for an agenda meeting. And that member was a member of that population whose age puts them at risk, and I don't know their other thing, but I just think it's very disrespectful of the public when you require people to come and put them at risk by not masking. Thank you.
Can you please finish it up?
I'm done. Thank you.
Thank you. Approval of last month's minutes.
Motion to accept.
Thank you, Carol.
And I'll second it. And then in discussion, Mr. Chairman, under public comment in our meeting minutes, is that how we, Tom, is that how we should list everyone that speaks during public comment should be documented in the minutes? You think, Mr. Hoff? I don't know.
I'm sorry, I missed the question.
Oh, under the meeting minutes from our last meeting, under public comment, we listed Mr. Carroll, public comment by Mr. Carroll were heard. Is that something we're starting to do now? We're listing, Lynn, everyone that speaks during public comment?
I remember, Rebecca, we should ask her again, but I think it could be done either way.
Yeah.
The name and the topic can be listed, but they do not have to be. So whatever the preference of the
Okay.
committee is, I think would be fine.
Thank you.
Okay, we've got a motion and a second. Everybody in favor of approving minutes from the last meeting? Say aye.
Aye.
Anybody opposed, same sign. We'll move on. Committee reports. Right?
Yeah, I'd like to give an update. This was sent from a health record. The LTL community has one positive COVID-19 active case at this time. This person was not tested at LCO. They used an at-home test, which may not have responded validity, reliability, significance. A follow-up lab test has been sent for verification. Contact tracing and quarantine are in place to contain possible contagion. LTO Community Health Center has vaccinated over 2,300 patients with Moderna and Pfizer vaccine. We have been holding regular vaccination clinics, but are seeing a decrease in patients wanting vaccine. LTO has paused use of Johnson & Johnson vaccines per CDC guidelines due to extreme rare cases of blood clotting. We are planning a mass vaccination in partnership with Hayward Hospital and Shore County Health on April 16th, 21 at the Hayward Community High School Gymnasium. We have scheduled COVID-19 vaccinations on April 21st to 28th at the LCO School Gymnasium. We currently have 3,400 doses of Moderna and Pfizer vaccines. As always, tribal preference is maintained in the vaccinations. And we are moving forward with that community effort now to vaccine as many as we can to slow this pandemic down and to help those who need that vaccination. I also want to add that our addiction specialist was on air today to update the information we have on our services we have for the people. And we are starting, now that we're seeing a decrease in the positive cases, we're seeing more healthiness in some ways. We want to help reach those who are battling those addictions and need more help and care. So we are trying to get them to the services they need now so that they're receiving telehealth, and we are transporting those who are in need. And so those are things that we are increasing, and we have things in place now to help those individuals across the board. It's providing more. We are still in the process of moving our domestic abuse program for the women's shelter to be able to house more women and children. We still are in that process. It's taking a little bit longer than we were hoping. We were hoping to have it done by now, but we still are pursuing that. We are trying to finish up those pieces for the transitional house that we need for those in recovery. So we're trying to get that piece done also. We do have planning going on for educating our people too who are in recovery and who need training for certain careers or certain jobs that I think it might be housing in Hayward here. We're working on a site for that also. And so we can continue to pursue those efforts to help those who are recovering from addiction and who need that extra support. We are trying to we got so many things going on, it's hard to remember everything. But we are trying to pursue the possibility of our new clinic. We're in the planning stages of that, so hopefully we can have our new clinic. We have outgrown what we have. We have one of the oldest facilities in any country, Nation. So we're trying to pursue that goal of establishing that. That'll take time, but then we will be able to offer more services that way also. And Pete, was there anything else?
No, I think you did very well. I know there's some mental health dollars and behavioral health money coming in the new rescue plan, so
Yep.
we're kind of making plans for that. And we expect to see probably some more mental health, behavioral health issues come up due to COVID-19 and people that are finally being able to come in and visit and see. So we're expecting going to be a higher influx of patients.
Yes, and we are working on our broadband services so we can help people have these resources even for education and health. So that pretty much sums it up.
I think addiction and stuff enough to deal with.
Oh, yeah.
Fighting COVID-19.
Yep.
Yeah. So,
And the tribe still is encouraging to people safety measures. We're not through this pandemic. And we have those variances here. So we need to keep protecting our people. So we have not let that down. We want to continue that and encourage others to do the same. Keep people safe.
any other questions? Comments? Okay. Move on to Joey Johnson and the Senior Resource Center report. There, Joey?
I'm here. Every year in April, we give our annual 8521 DOT report. The report has been filed with the state and has been accepted by the state and verified. Our financial information has been verified by Carol Guplinski from Department of Health and Human Services, and also by Mike Keith. Every year when we do our financial end of the year report, we always work with Carol and Mike Keith to make sure that we have everything is in order and everything matches. And as you can see, revenue and expenses were down, and a lot of that this past year had to do with COVID. And if you look at the trust fund, which is one of the last parts of the grant, we did have an opening balance when we started in January 1 of 2020 of $8,262.41. And then this year, because of COVID, the bus wasn't running like it normally does because people weren't going out, people weren't going places. So we had unspent money again of $11,590.77. And then we accrued some interest. And so we have an ending balance in our trust fund of $19,901.53. And that is in a separate account that is not, it's in Edward E. Jones, so it's not commingled with any of our other accounts. And that money will be used for if we have any major expenses for the bus, because the bus is kind of limbering along. We are going to be applying for a bus through the DOT in August. And if we do not get a grant for the bus, last year they only gave one grant, only about one a year now. With that 19, we will have enough for a down payment, and working with our accountant, if we don't get that grant, we should be able to, with what we have in reserve and how we've been managing our money the last couple of years, we should be able to get a bus without that grant and be able to afford monthly payments. So that's kind of where we're at with our DOT grant for 2020. So like I said, the financial report has been accepted and approved by the DOT by John Swisler. Any questions?
That's good. Great, Joy, I have a question.
Sure.
That trust fund, is that different from the fund that was set up to help maintain the building itself?
Yes, it's definitely different. We had to verify with Mike Keith and with the state that we truly do have that money and it's separate from any other money.
Okay, thank you.
You're welcome.
Any other questions? Health and Human Services. Cap meeting. Who wants to do that?
Talk about it. Right. At Human Service Day at the Capitol today, and it was via Zoom from 9 to 11. And on your agenda are the issue papers that WCA and WIXA sponsored were reviewed. And then talking about some of the key points we want to share with our legislators. I was there, Mr. Schuman was there, Mr. Hoff was there, and Mr. Schleter was there. And I think we concurred. We'll probably talk a little bit about more. But we support these issue papers, but we don't know if that's going to be the focus of what we're going to emphasize with our legislators. And probably the main conversation is going to be about these high cost placements and what we can do about them. You'll notice on BNC on Friday, 1 o'clock, we're meeting with Senator Petrowski and Representative James Edning. And then at 2:30, it'll be with Senator Bewley and Representative Myers. And I did send, I'm not sure who's all going to participate in it, but I did send invitations out to the county board members. If anybody else, then it'll be up to the CAP team members here to decide who's going to be there. So, you guys, anything to add?
I just have a couple more comments on that. You know, under 8D there, you've got the issue papers, as they call them. So these are the papers that are prepared by the Wisconsin Counties Association that help drive what the county's viewpoint is on the state budget and some of the other issues that are facing Health and Human Service Department. So, you know, when we talk about legislative changes and how they happen, this is how it happens, and what drives it is the counties getting together and saying, this is important in the budget. We need this. This is why. A lot of conversation happens between the WCA legislative staff and the people down in Madison. And so this CAP Day, this event that we had today gives us kind of the background on what they've been working with those legislators on, so that we can meet with our legislators, our local legislators ourselves, and tell them our personal issues on each county, not personal, but I mean personal to our county and the issues that we're facing. So that's a good one-on-one, and that's what's happening Friday. So those that are interested and have the time to participate, talk to Paul, and we'll get you set up on that. But this is, you know, this is where the action happens as far as getting those things into the budget that are helpful for the programs in this department.
I'm going to add, we got about 20 or 30 minutes with them. I set up an hour Zoom, but usually it's 20 or 30 minutes. You spend 5-10 minutes, everybody's kind of saying hi to each other, and then you got even 20 minutes to get the meat of it. So that's how it's gone when we've been down in Madison. Sometimes they give us a little more time. I have no idea if we're going to get that extra time. I do want to comment on the mental health services one here. I just want to point out that it does not address these high cost placements. What it does, there is something new that could be helpful with us, is Joe's a primary person who works on crisis. And so if we have to hospitalize somebody in one of the local hospitals, usually in Eau Claire, if they're not open, the default ends up going to Winnebago. And a lot of times those are short-term stays. What this will help, it might create some other entities that can take these crisis placements rather than going to Winnebago, which would help us. But I want to really emphasize that usually those are short-term placements and then they get released. The ones that we're going to probably talk to legislators about are the ones that when they go to Winnebago, they're assessed that they need an extreme high level of care that's well, we've talked about that. We'll talk about it a little bit when we get to behavioral health. I just want to point out that difference.
So, I sat in on that today also, and they talked about, the one lady talked about 30 other states and the District of Columbia have gone along with Medicaid expansion. And here we sit in Wisconsin, and I think I asked Paul this question, what are we waiting for? And apparently it's a political,
Well, I said, who was the previous governor?
Yeah.
I said, it was Governor Walker. He turned it down. I said, we live in a political divide, and I don't think that side of the fence was in favor of it. And you could,
so what does Medicaid expansion do for us? I mean, would it help? Obviously, other states all went for it. Is it for reimbursement or is it for eligibility? Maybe Dr. Dunlop, yes.
Probably not very well.
Wonder if Patty would know.
well, it expands the people that are already receiving those services. I don't know how to say it's politically correct.
Yeah.
That
Give it a
there's
shot.
certain people that think they don't need government aid, and this would be more government aid for, those kind of people. I'm just gonna say it. And I think this would open the door for more people to get more support,
So more
Like-
care, more reimbursement.
like Medicaid, like food share, those types of things.
And then one lady, the Secretary of Health, right, the Department of Health, I can't think of her name right now, the Harvard grad, just went over and over it that is something we need and we need to all advocate for that. But anymore, you just,
No, it's where our country is right now. It's
Paul, were there other concrete reasons why the governor turned it down, other than political, other than,
I don't know his reasons, and you'd have to go back and look in the media what the reasons were. My knee-jerk reaction is that side a lot of times doesn't believe in the government handout, so they just don't want to do more of it. That's my assessment of it. If that was, I don't know that they would exactly say that, but I think that ends up being what it is.
I would like to, if somebody could find statements that were made about why Wisconsin should not do it. And then we could perhaps refute those when we do meet with our legislators.
Well, it's out there. We can try to look it up.
We could have a list of,
we need to push that with them.
But I think my statement is the unsophisticated. So
well, it's maybe unsophisticated, but it's probably named after.
What time is that meeting?
Big part,
What time is that meeting? Right,
Friday afternoon.
Friday afternoon?
I can let you know. I can share.
Yeah, let me know.
Yep.
I'd like to hear something.
it's on here, the one on letter B, that one starts at 1 o'clock.
Okay.
And the other one starts at 2:30. And I think there's two ways you can do it. I can send you the link of this, so you can watch it on your own computer or
Yeah.
laptop, or do you want? We're gonna do this. It's gonna
I
be
think so.
here.
Right,
It'll
then
be
you can
here.
set up a Zoom meeting in here.
Is that for Friday? I have not worked on it.
Friday afternoon.
Are you gonna do that meeting?
I'll have to do it because I set up my Zoom account.
I'd like to hear it.
So they went over Governor Evers' budget and all the money he's allocated for Health and Human Services, and how much is that actually gonna be realized with the Finance Committee being, what's the word?
Way too early to tell.
Oh,
what's
it's, I
happening.
don't know.
I mean, because it seems like he's going a long way for Health and Human Services.
Yeah.
If even most of that gets realized.
friend of mine once said the devil is in the details. But it would be nice to have some input about how we think that money could be best spent, rather than waiting for them to tell us who knows what tangents that they may get off to. Do we have any comments online?
I don't have any hands up.
Rick,
Mr. Chairman, before we leave this, so what is our plan with a dwindling fund balance and Winnebago? You know, we're actually gonna see more clients there. Maybe how would we ever realize paying that? And what would we do if we just can't pay it?
Well, that's under
Or is that
behavioral
coming
health.
up?
That's where we
Oh.
have that chart and we can talk about it.
All right, sorry.
That's where we're gonna, yep.
should we move on now? Okay. Adult long-term care,
All right, Lori Perlich submitted a report. I'll highlight a couple things here. She's not here. They're working in concert with Julia and her team. They received an outreach grant for the COVID shots for people that are homebound, and maybe Julia will talk a little bit about that when she's up. I also want to highlight that their information and assessment specialists pass their functional screen exams. They have to take them every 2 years. It's very difficult. It's very tense, very anxious, and all of ours pass theirs.
Could you repeat the title?
It's in a report. It's the ends up being a functional screen exam, but it's in a report. And they all pass it. And if they don't pass it, they have to wait another 2 years. They basically can't do the job. So it's really nerve wracking, and they did a really good job. I think their average, I think she had was 93 something percent. Yeah, 92.3. So. All right.
will please pass on to them our appreciation of their hard work and scores on their tests.
We'll do.
Yeah, very well.
Now we have the behavioral health.
Okay, the first report we have is from Alicia D. Carlson, and hers is complete with a lot of information. If you have some questions for her, she's here. I'll try to highlight a couple of things. We lost our medical director for the clinic, and we're looking to recruit another one. In the CCS program, we were advertising for a service facilitator. I don't know if we touched on this last one, but with the Children's Long-Term Support Waiver Program, CLTS, the state has this new wait list, and they're the ones that are overseeing it, and they're deciding when it gets released and when these individuals get referred to the county. And I think we're getting like 1 to 3 per month. And we're realizing that we didn't have enough FTE to cover that. Our 2 people right now are pretty maxed out. And so Alicia approached us, and so what we did was it's going to be a combination of the service facilitator, part-time service facilitator, and part-time CLTS. And we recruited somebody, and this person accepted. So there is a win for Alicia's unit there. Very engaging person. I think you'll like him. Get a chance to meet him. I think. Oh yeah, the other big one is. We've been looking for a CCS therapist, mental health therapist, for a long time, and North Lakes is now on board, and the person went through the training. Alicia was involved with it, and it sounded like it was a really good meeting, and she's ready to rock and roll and work with us on that. So that's fantastic. Okay, the next one is you'll have an Excel spreadsheet, and I want to say that Joe initiated a further conversation on this. He talked to Cindy Hannes, one of our fiscal people, and so what they did was it's kind of piggybacking on what we did previously in a meeting here. But they went through, and we don't have the people's names, we have numbers to substitute for their names. But you can see on here what their placements were and what the cost was over 14 months. But the one thing I really want to point out on this is on the bottom. Joe and I and Alicia and Patty and Cindy all talked, and we kind of decided that this statement is important to bring to the board. I'll summarize it. There's currently 3 people, two are in Winnebago and one's in Mendota, at least 3 right now, that at the time of this and talking to the state, the level of care that they needed was probably going to cost us a minimum of $2,500 a day. And if that was the case, if you project that for a year, it's over $2.7 million to the county. I know Joe is very creative and has done a lot of things over the years to try to come up with some creative placements. But he and I talking together, I thought if we try to do something that doesn't meet the level of care that the psychiatrists and psychologists are recommending at these institutions, it puts us at a liability. So I put the statement here and I took it to Tom. I'm going, I think we're at the point where we need to get some legal counsel about what we can do if we can't pay this. And so Tom referred it on, and now it's that's where it's at. And I think where we're at is this is probably what we want to talk to our legislators about. I don't think this is going to change right away, but I think we need to impress upon them. Even just one of these is too much for us to take on, let alone 3. And there's even a 4th one out there on the periphery that might be. So we just don't know. This is really fluid. And then we have no idea who else might come up within a year. You just don't know. But again, when Cindy put this together, we're just an aha thing. I'm going, why are we? Joe is a seasoned professional. I think he likes to come up with solutions. But I think we need to pause that. If we go to level of care, what the psychiatrists are recommending away from Winnebago, I think we're putting ourselves at risk. And I brought that to Tom.
Well, we tried that once before with our other group place over there, and we had a little problem. Remember, a couple years ago, 3 years ago.
Right,
And
and it's something.
I remember, Carol.
that didn't meet the state requirements or whatever, and they were gonna fine us and so forth, but we were giving the best care we could. And we were licensed to have that person, but
You did get a fine out of that. It was 10,000. They reduced it to 64 to be
Yeah.
paid within 60
Yeah.
days. So we can-
and you were licensed to put that person there, and everything was done according to plan. And there still was a problem, so the liability is big.
And Joe and I and Carol's involved in these state conversations is that they're looking for places to place them. And a lot of them are just, they say we can't handle them. Now there might be some hits, but they're very expensive. And we're at the point where at some point they can't keep them in Winnebago or Mendota, and we got to give the green light. And you're all going to have to know this is an expense the county's going to incur. And I don't know if we can head it off with the pass, so to speak. So.
Have other counties run into, I'm sure they have, had clients who were just beyond the scope of our financial ability. You wonder what their solutions were. Can they sever it and turn it back to the state, or does it go back to the courts, or?
That's one of the things that we're investigating, as Paul alluded to. This potential of 2.7 million, or whatever it could be, it's a big number, and obviously too big for Sawyer County to handle. Our total levy, our total tax levy is $10 million.
Right.
And that's for all the services that we provide. And so to take a hit in one area of even the actual expenses that we have now of 1.8 or 1.58 over 14 months, that's more significant than we've seen in the past. So these costs have been climbing. And it did take a hit to our fund balance in this area last year, which we knew was going to happen, but we can't take that hit, next year and the year after. It's the end of the road as far as being able to use fund balance. So what do we do? So we're looking at a couple of areas in the statutes that may allow us to pay for it in a different way, but we're trying to get either legal counsel or the Department of Revenue to take a look at the levy limit laws and how they affect this area. So there's a couple of things that we're trying to investigate, and we'll report back once we get answers either from DOR or from state DHS. But and as Paul said, the legal counsel that we're going to be consulting with has experience in this area around the state, and what other counties have done. We've also talked, obviously, Paul and his group talks, amongst themselves, and I talk to other administrators in the northern county. There's one other county in the north that is experiencing worse financial difficulties than we are, and they're in deep discussions with the Department of Revenue as far as what can be done if you get to a point of not being able to pay. So yeah, it's a moving target, a lot of pieces in motion right now, but we're investigating a couple different areas, and we'll report back when we get some more answers on it.
So who runs Winnebago? I mean, is that a third party person that's real profitable or
It's a state run.
a state run, state owned, billing all the counties for their clients?
Well, and it's expensive, but as we found, there's places that are more expensive than that. And if, people get turned away from there and end up in somewhere more expensive, then it gets, yes, it's expensive. Is it exorbitant? Probably, but these people need a lot of care, and that's a high cost.
And insurance only covers portions or sometimes, I think you said,
Very
because
brief.
their benefits get
Briefly,
exhausted.
there's caps on it.
Caps on it. Well, like I mentioned before, there should be a cap on the cost they can charge us.
Yeah.
Well, somebody's
I
got to
mean,
pay for
We don't even, what do we budget now for this, Tom? And I know it's been a question ever since I've been on here.
it. Patty might have it at the top of her. Yeah, I don't.
And when we tried to budget, and we never could budget enough.
It's
Or
never-
what the
it's
actuals were
never- it's
gonna be, I
never
remember
gonna-
that.
it's never gonna-
I think it was like 750,000, wasn't it?
Yeah, and that was the most that we've ever budgeted. It used to not be budgeted at all, and they would just take the hit to fund balance, but as those costs started going up, we started budgeting, as much as we could each year, a little bit more, but it hasn't been able to keep pace with the amount of expenses that we've incurred. And so our, even when we were under budgeting the last 5 years, we were still overall in this department able to meet our expenses, and our fund balance was increasing. So we had a fund balance of over $1 million that had been accumulating over time. And then this last year, when we had, a major hit, it took a big chunk out of that $1 million. So we can't take another $1 million hit to fund balance because it's not there. So, it's either, we find a different alternative of paying for this or something. But right now, there's not a good answer.
So maybe there's money in this new rescue plan that's coming down that might offset, because they're expecting more mental health,
Yeah, but
behavioral
those are-
issues coming from COVID.
yeah, those rescue plan funds are one-time funds. That's not going to solve,
Right.
year after year
It's
after year.
temporary.
But we're probably gonna take a big hit post-COVID in this department because of what's gone on. Am I way off, Paul, or?
I don't know how it's, it could be, but I just know that talking to Joe and Alicia and some of the other supervisors and the workers, they're seeing a whole lot of stress and mental health issues, and
Oh, yeah.
substance abuse issues in the families. I mean, it's out there. What that's gonna translate in terms of the budget, I don't know, but it's probably not gonna be in our favor.
Right.
I mean, these folks here are people that have been in the system for a while, that type of person, maybe crisis or somebody that comes up who is normally functioning fairly well, but then has problems as a result of this. The absurdity of this whole thing is that these people are all on disability.
And-
They have disability, they have a medical card, and that doesn't pay for any of this.
Right.
And when they're in Winnebago, their medical card is no good. So when they send a thing like we got one today, so-and-so needs to go in for a procedure, we're funding the medical portion of somebody who is eligible for medical services by determination of the disability. So the county actually becomes like a healthcare provider of sorts. And it's absurd. The majority of these people, I would say more than 50% are not from here originally, but they came here because families moved here, and they bring their extended children when they have problems. They understand that's how it works. But the thing is, none of these things are funded by the entities that should be responsible for them, in my opinion.
What are those entities, Joe?
Will be the federal government, when somebody's determined to be disabled. It would be when somebody's disabled from the military, and we're picking up all these costs. How the heck does that happen? Somebody joins the service, the government, I don't understand that, why we're paying for all these funds for somebody that's on 100% disability from the United States Service. It makes no sense. But that's how the system is all over here.
One thing that we have talked to Wisconsin Counties Association about, and Tom, you've done this in your administrators gatherings, is to make these outliers, make the state of Wisconsin as a whole responsible for the outliers. They're not getting very far. To me, that's the only potential solution that I've heard of. Every county may have one, or some probably have none, but if we put them all together and let the state and all of the taxpayers in the state of Wisconsin pay for them, and then if that became a problem for our state legislature, then they could go to the federal government and maybe take it a step up further and solve some of this absurdity that you're talking about.
Well, you ask what other counties are doing. When Paul and I contacted that county down south, and we had an individual placed in Racine County, and they were having some problems, and Racine County didn't want them down, And the director from another county down that way told us, I can't imagine why Racine would want to do that, because they had somebody that was under commitment to them, high cost and whatever, and they placed them in a group home in another county and then vacated the order. They vacated the commitment order, they vacated the guardianship, and the other county got on the cuff with millions of dollars, right, Paul?
Yeah.
So,
My
those are the things other counties do. Some of them,
Well, that's,
Well, hey, there's an option.
That's not what we would do.
I'm kidding.
that's another viable
Right, but just that's what some counties do. They have high cost to get them out.
But I think these individuals we're talking about, they're really truly outliers, because the one county director that Joe and I consulted with is really involved in Wixon, the behavioral health stuff. And she even said they rarely have ever had anybody in Winnebago more than 6 months. But again, it's their psychiatrists, psychologists that are making these assessments, and they're thorough. I mean, that one is really thorough, Joe. And this is what they're recommending.
We'll give it another push.
Yeah.
Right.
Thank you.
Well, do we have a plan? I mean, we should all be together on the same.
Yeah,
Paul, you talked
strategy.
about that. The
Yeah.
strategies. Thank you, Carol.
Well, you had mentioned it the last meeting, right? We don't want to get together at 12 o'clock or something before we.
Because I've met with these guys before, and it seems like you don't get anywhere.
Yeah.
I mean, and maybe we gotta help them make a decision. Like, I really feel that the cost to each county should be capped. How do they expect Little Sawyer County to come up with millions of dollars for 2 or 3 individuals
Exactly.
that we don't even know if they're coming? How are we supposed to budget them?
Let alone, we don't know if the other ones are going
Right.
to wait in the line.
There could be
too.
more.
You have no idea.
That's not a bad.
So could you plan a strategy meeting beforehand? I suppose it's too short notice now.
Well, we got email.
We started a little bit today, but I think it's, and I can share this thing on the screen and then that summary one about the 1.5 or something, and just to kind of have something to look at. And I can all send it to them too. And
I
talk to
think
them,
they
have it, talk to them like we're talking to them, like you guys right now. I know it goes fast because we've been in their offices and you don't have much time.
Maybe you need the shock value. This county just plain can't afford $2 million. And we are going to refuse to pay the bill. So what happens next? Maybe you gotta really push it in the face. Because you have talked and talked and talked around this. You've done everything you could. So I think it's time to really push the boat.
It would be
We
nice
can't
if
do it. We can't do it. We can't afford it.
we can't say that we aren't gonna pay the bill because they take it out of our aid that they give to us. So if they give us money and we don't wanna pay, they say, too bad. They just won't pay us that much money.
Okay.
But your point is, to be more aggressive with them and say, this is the end of the road for us.
Well, I think, yeah, it's the end of the road, but, I feel real empathy for those folks that are down there. I mean, their lives have gotta be horrible to be in a situation like that, but by doing what's happening, the taxpayers' dollars in Sawyer County, do we need to cut services to everybody here for 3 people? I mean, is that a shock value right there? Do we need to cut programs
Right.
to pay for a couple individuals that we have absolutely no financial control over? Where do we go from here? Make them give us an answer.
Well, they are dealing with,
Want to come?
Yeah.
Yeah, I would
Carol, you want to come?
I would-
What about-
Seriously.
That's good.
Chairman,
Mental
leader,
health is such a big crisis, and everybody for years have refused to bring it to the front. All of our symptoms, is Joe and Leisha and the rest of people that deal with addiction, mental health, all those things, family problems. It's a mental health issue. It's a snowball that's getting larger and larger. We can't afford to pay for it.
okay. Don, were you trying to get in on this?
Yes, sir.
Go ahead. You have the floor.
I will not be available Friday. But my sentiment is, as it always has been, we have been knocking on the doors. It's time to start kicking them in. If they cannot give us any resolve on this issue, then there comes a time and a place where we have to sit down and decide if we're going to chop them off at their ankles or their knees. It's time to chop them at the knees, as we would say it Chicago style. You will maybe have to sit down, which I know no one wants to do, and maybe we have to go public with it, with the issue, what little northern Wisconsin rural communities, counties are dealing with, and put it out there. We are not the only ones in the United States that are facing this, and that we need help from the states and from the federal government. We cannot keep picking up, the county cannot pick up medical bills that should be covered by the federal government. There has to be legislation. There has to be something. They have to do something. We can't just keep saying, hearing, okay, 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 and year after year, it's the same issue. It becomes where maybe we have to go public with what is going on in our community. And that we as a community, it is not fair to us or any other United States citizen to have to deal with this. And it is not fair to the people that are seeking the services, because there are many that are out there that cannot even get in the door because of issues like this, because of the counties are overridden with, they don't have the money, they can't place them, they don't have the funding for it. We are not the only ones. And that's what I would want to push to the individuals you are speaking to on Friday, that we're at the breaking point. So what do? We can't balance our budget, and we can't know how much we're going to expend for this every year, because you never know. We could have 20 people coming in the door next month. And what do? Do we go belly up because we can't afford it? It's not an option.
Dawn, this is Dale, Dawn.
Yep.
One of the things that is happening in northern Wisconsin to the north of us is there is a county that is in even worse fiscal matters than we are right now. And the Department of Revenue is dealing with them. I think it's very important for us to pay attention to how that goes.
Yep.
Because we are getting their attention. So we are on the right track, and we're kind of, this is something we can talk about on Friday too.
Okay.
One more thing, Dale.
Please.
Yeah, you mentioned going public. We do have an appointment, or are making an appointment with the Sawyer County Record to develop an article on this, not only our county, but other counties. Mr. Zufall contacted me last week and offered to get together and investigate this issue. So we'll be talking with him when we get that set up. I don't know if you've talked to him yet or not.
No, I need to give some times for next week, and then I can look at Joe's and my calendar so we can speak. You know, another thing we can do, we should think about doing is not only talking to them obviously on Friday, but really invite them up here to talk to the board. Face to face.
Yeah.
At some point.
Yeah.
We've done that before, if it was a good meeting. Let's do it again.
Have them come up here? Yeah,
Let's do that. We can extend that invitation on
yes.
Friday to them.
Well, they did come up for the courthouse issue we were having. Remember, he sat right on the bench with our judge. They'll come. That's a great idea.
Yeah, I think so.
Okay, folks, where?
Right.
Where exactly are we at? Executive services and youth justice?
Yes. Tom asked me and Brittany, our youth justice supervisor, to take a look at Oasis and just assess it, look at its viability and all that. So she and I worked on that together and got a lot of really good data also. She had some data from the past, and then we had Cindy Hannes, who keeps some really thorough data for all sorts of things. And so we looked at that, we processed it, and and Brittany has a PowerPoint that she wants to present to all of you tonight, just to kind of give you where Oasis is at this point. And then kind of get a sense what you might want to do.
I think there is one that you all have in your packet, but we did make one update to it, so Alex has it on the screen as well. So one of the reasons, or one consideration going through this is that our current MOU with Oasis expires at the end of this year. So in our current MOU, we have a 6-bed guarantee. And so what that means for us is that, just because we have new board members, so I can kind of explain what that means. Surrey County is responsible for paying for 6 beds at Northwest Oasis Group Home. So there's currently 8 beds there, and Surrey County pays for 6 beds. So if we are not using those beds, or if another county utilizes those beds, that offsets our cost. And so throughout the PowerPoint, you'll see where we talk about empty beds. So there's placement beds that we paid for where we're utilizing those beds, and then there's empty bed costs that we're paying because no one has used those beds. So that's kind of that bed guarantee that we're talking about. Is there any questions on that? How that works at all?
How many normally have?
How normally have what?
Like, how many?
We'll get into all that we
Okay.
kind of break that down per year, but I just wanted to explain how the bed guarantee works in case there were questions on that as we're going through.
You're cutting from six, like you said, a negotiable.
That's a negotiable per MOU, so that has kind of changed throughout the
Okay.
year. So currently we're at 6.
Okay, if we could be quiet. Get on with the presentation, please.
So kind of just some historical information. When Oasis was first opened, some of the barriers that were listed that led to the proposal was the closest group home was in Ashland, and that's still current. There are 74 licensed group homes in Wisconsin. 49 of them are for males. And there's 16 like viable that we could use for placements. That's including Oasis. But the closest one to us is Ashland, and then we have Oasis here in Hayward. There's difficulty with family involvement, services, and placement. So if we have kids placed in Ashland or Eau Claire, Chippewa area, it was difficult to work with the families at that distance. Loss of community support and school involvement when those kids are also placed at distance, and sink or swim reintegration aftercare. So we're talking about bringing kids back into the community from a distance, and it's just like, okay, now you're home and things are what they are. So having Oasis, the goal was to kind of have a slower reintegration during home visits and that type of thing. Some of the goals of Oasis when it opened were to provide a comprehensive community-based service to children, to maintain or reduce out-of-home placement costs by utilizing a group home model where the group home is the hub of services. So Oasis utilizes the hub, but they're utilizing services out of the group home, utilizing county services, North Lakes, Marshfield Clinic, the hospital. So they're utilizing services, community services, but they're staying at Northwest Oasis. The goal is to maximize revenue opportunities by creating fluid and flexible treatment model, by utilizing targeted case management services and building crisis stabilization services. We can go to the next slide, Alex. Thank you. Target service groups were status offenders. So these are all in our 938 chapter. So these are kids who have like criminal misconduct and delinquents, minors in need of care, all juveniles equivalent to 938.13, all post-treatment non-mental health juveniles or court sanctions. So the programming at Oasis was primarily developed for juvenile delinquent type behaviors. On case-by-case basis, they would consider taking child in need of protection or so like the CPS type placements, but it was intended to be on rare occasion. Family proximity. Bringing the proposed group home program to the county would allow Northwest Passage to work more closely with the child's family and current providers, which is critical to the long-term success of the child. So this is where we kind of get into the financial part of the status of Oasis. So in 2021, these slides work backwards. So in our current year, this is just from January 1st until March 31st. Our current empty bed costs, we paid $38,917 in empty bed cost. So our total costs were a little over $76,000. So we've paid more actually in empty bed costs than we have in actual placement costs so far this year. The total census for Oasis, we're at 70%, a little over 70% for a total census, and only 28% of those have been Sawyer County placements. Do you have questions on 2021 so far? Yes.
Well, I guess I do that previous statement you said before this slide, did that actually come true then, that it did benefit the children to have this facility closer to their families? And
I think it's difficult to measure that. I mean, that's the goal, is to have, the families invested and part of their care plans, but that depends on the family and that depends on, a lot of different factors. So I think it's difficult to measure that.
Okay.
Because I think that's
I did ask that question to
right.
Brittany because it's been a while since I worked as a therapist, and I get some of these juveniles referred to me, and or if they were CPS kids, whatever. The major problem, there was usually a problem with junior, but the bigger problem was getting the parents engaged. Okay, and so I think a lot of times where these kids are having problems, is the parents have challenges and not necessarily engaged. And so the level of kids that had to go to Oasis, I was really curious, were they really, really able to engage the family, and how often did it happen? I don't think they kept stats on it. I was just curious, how often did that really happen?
Yeah, and it's, like I said, it's a hard thing to measure statistics on, but kind of the conversation that Paul and I had, if a family is engaged, they're going to be engaged in Hayward, or they would be engaged in Ashland, or they would be engaged in Chippewa. If they're going to be disengaged, they would also be disengaged in Hayward or in Ashland or in Chippewa. So I don't know that that's a consideration or something that you would need to keep statistics on. I think it's family specific.
Would it be safe to say it was a challenge?
It's always a challenge.
That's all I want to say.
It's always a challenge working with kids.
I mean,
Go ahead, Doctor.
Well, I was gonna say, is the flip side always also true that 70, almost 75% of the residents or of the clients are from out of the county?
Yes,
Okay.
Yes.
So they don't really think that it's necessary to keep their clients in the county.
Correct.
Okay,
Any other questions? Okay, so we can go to 2020. And so this gets a little more in depth because we have more data. So 2020 overall, we paid $56,985 for the total year in empty bed costs. And their average census was 88%, a little over 88%. Average Sawyer County resident was 29%. And then Paul, did you want to explain the 1.4, how you calculated that?
I'd have to have the raw data, but what I
Yeah.
did was I just look at the number of days they were there for the whole year, and I just divided it by that number of days. So we averaged 1.54, but that number could have came in a big chunk during the year. So we're averaging throughout the year less than 2 Sawyer County residents in 2020. And also remember the focus was supposed to be on YJ, and so keep an eye on the difference between YJ and child welfare placements, 5644. It's more even, I think, than what was proposed.
I was going back years when this was first developed. Am I wrong that part of the plan or proposal was to have that family involvement or caretaker guardians? Wasn't that part of the proposal that we thought that if these youths were going to be successful, that it was part of the goal was to have the family involved, or that otherwise they didn't meet the criteria?
Yes, and that's where I took that family proximity off of the 2010 press release. And I don't know that anyone could anticipate whether or not you would get that family involvement. So I don't think that it was. I think that's always the intention, and I think it continues to be the intention to have the family involvement. And I believe that's still something that they intend to do. I just don't know that we're in a spot right now with families in the way that families are in the community to get the family involvement. So it's something I think they're still attempting to do.
Chairman Schleter.
Pardon
do you have a question for Brittany?
Yes. Well, what I'm sitting here, Brittany, is I just added up 2 years of empty bed costs. So we're looking at $94K that we've paid out of the county. Is that what I'm looking at?
So are you
As a
looking
county.
at 2021 and 2020?
Yep.
Yes,
So basically,
and that's the first 3 months of 2021.
right. So we are paying 28%. We're funding the program with taxpayers' money to provide a service for other counties at our expense, our taxpayers' expense. That's what I'm hearing.
Yes.
So when I questioned HHS about this, when Mr. Bauer sat on the board and asked what was, not that it was a moneymaker, but I was told it broke even. We are far from breaking even. I am so beyond furious at this moment about this program, because this is one of the spots that we had said when we were doing the process for the courthouse. And if this was something that was actually that it was a necessity in the community, if it was being used by our residents. And we were led to believe that was the case, it was breaking even. And I'm looking, if you're saying the first 3 months of 2021, and then 56,000, almost 57, so more like 95,000 that we could have had in our budget for other programs within the county and your department. And I know, Brittany, this isn't your fault, but this is beyond okay. And why was no one else overseeing these numbers and seeing what was going on?
Okay.
I guess, Paul, that would be a question for you.
It's a question that I'm not comfortable discussing in open session.
Okay.
Go ahead, Brittany. Let Brittany continue.
Yeah, okay.
Continue.
Sure.
We'll get to the discussion afterwards.
Okay.
And questions.
Continuing on to 2019, our total empty bed cost was 36,482. And the average census was a little over 91%. So the group home overall did have a higher census. They had more residents there throughout the year. Surrey County residents averaged 26% that year. And we did have higher child welfare placement of about 77% that year, you can see. And you can kind of see where we're at with empty bed costs this year, because the empty bed cost this year has already exceeded 38,000, and we only paid a total of 36,000 for all of 2019. So, we're not on a good track for 2021, as we can see. And they have been working towards getting referrals in, but it has been a struggle this year for the empty bed cost.
How much has COVID impacted?
Excuse me.
Sure.
Hold your questions, please.
2018, and total empty bed cost is a little over 17,000. Total census averaged a little bit above 95%. And youth justice placement and child welfare were 50-50. Going back to 2017, empty bed cost was a little over 15,000. Total census was 95.5, and they were all youth justice placements. And then going back to 2016, $5,000 in empty bed costs. Total census was 98%, and we were at 56% with youth justice placements and 44% child welfare placements. And then the next screen is comparative data, so you can see the increase in empty bed costs per year. And 2021 is not on there because it's not a full year, so I didn't include that. But that shows the increase that we've seen over the last few years with our empty bed costs. So if we go to the next slide, we have just some considerations for us. Our current MOU expires at the end of 2021. The biggest thing that would mean for us is, like I said, right now we pay for 6 beds, and utilizing the out-of-county residents for them to come in, that offsets that cost for us, but that's kind of the primary piece that is negotiated in that. And it's a consideration that our empty bed cost continues to increase. We're currently averaging less than 2 residents per month, as you can see in the slideshow, and it was proposed while the group home was opening, but they've discontinued the targeted case management, and they don't currently bill for crisis stabilization services, which were intended to offset some costs as well. So that's not offsetting costs currently. So just, like I said, some considerations.
Thank you, Barry. That had to be a tough one to deliver to a hostile crowd. I would like to question first.
Sure.
If we did not have Oasis, and there's a lot of things in the past that I'm concerned about, but if we do not continue Oasis, what would it cost us to send our Sawyer County juveniles elsewhere this year?
So other group homes that have a state set rate, so we would pay whatever that daily rate is, similar to other placements that we see. Like currently Oasis, their current day rate is $243. So right now we're paying that times 6 for the 6 beds that we have. To place at another group home, we would pay that per resident rather than 6, no matter what.
Mm-hmm.
So say like right now I have 1 resident at Oasis, and we would be paying that, or whatever the group home, I mean, their their rates are set by the state and it's right around that rate. So we would pay that, that one resident at the one group home rather than the 6 beds.
So there would be substantial savings. Well, from now, I'll open up the floor to comments and questions.
I have a question, and it's, I haven't heard too much hostility, so it's not, none of these, we're just questions.
Right.
I said that wrong, I was making.
Not. So what would happen to Oasis if we just paid for 3 beds or 2 beds, 2 to 3? It wouldn't apply.
So the conversation that I've had with Passage up until now is that if it's basically, I guess, a negotiation. So if we were to say, because they obviously count on those funds, whether it comes from an out of county or from Sawyer County, that income from the 6 beds. And so if we said we can only pay for 3 beds, their director would take that to their board and say, is that financially feasible for us? And they would say, either it is, or no, it's not, we can't stay open.
Can I ask a question?
Well,
Is
you
Dawn
have-
back?
I want to go around the room first to make sure everybody else has a chance to speak first, which we learned at the board meeting last week. Tweed, do you have a question, comment?
I'm in deep thought. Go ahead.
I like to.
Ray?
I can't believe that we don't have those beds filled. I'm not sure, because to me, I would think we would need that for more of our young people. And I'm not sure where we're missing that boat. Is it the court, is it the ICW, is it the county, how are we missing these kids? To me, it seems like we would have those beds filled. That's what I'm thinking. And I worked with young people for many years. And in fact, I worked with some of the kids from Oasis. And the children needed that care, they needed that support. And you're right, when it comes to families, it's hard to get them engaged, and depending on the healthiness of the family. But it helped those kids. I remember that.
Yep.
That's why when I'm looking back at these years here, and I had contact with Dave, and I had contact with some of the workers from the facility, and I had different ones, but I just can't believe that we just don't have them filled. And so I don't know what's happening on that part.
It's also, it's not just about filling beds as much as it is finding the right type of placement. I think at any point you could bring in kids from out of county and fill the bed, but you have to find the right resident that's suitable for the type of facility that's not a high risk to our community, especially if we're bringing them from out of the area. You have to find, you can't, it's difficult to place too many kids from Sawyer County, for they're all friends, they all go to school together. Do they escalate each other's behavior if they're there at the group home together? Will they run together? Will they use together? So it's a little bit about balance, about, strategically placing kids there at the right time, not all together at the same time. And, we do, at least in youth justice, we fight really hard to keep our kids in the community. Deidre and I, at least, we try really hard to keep our kids at home, and we try really hard to try to utilize our community services and use placement as a very last resort. If somebody said fill the place up, well, we're not going to place kids just to place kids either.
No, I'm not saying that. That's not what I'm saying.
Right, I know.
What I'm saying is, it appears to me that we have those individuals who need that support. I'm not saying just put anybody in.
Right.
I'm not talking about the county.
Right.
I'm talking about our county. And it just surprises me that we have a service here being provided and it's not being utilized the way it's supposed to. That's what I'm saying.
But to meet the criteria of, you may see kids in the community that seem like they need the service, but, are they on a delinquency order?
Yeah.
It's like, they may seem like they need the service, but do they actually meet the criteria based on the court criteria? So it looks a little different sometimes. I don't know.
And I know they have the criteria.
Right.
I don't know. I just is what I'm
Right, no, it makes sense.
Okay, is there anybody online who wishes to speak?
Yes, I do.
Who hasn't spoken? Okay, you're on, John.
I have a variety of questions. When was the last time the MOU was up for review?
The date on the MOU was 12/21/2018, and that went into effect, January 1st, 2019.
Okay. Next question. Who made the initial deal with the county paying for 6 out of the Northwest Passage's 8 beds?
I can't, let me, yeah, I mean, it's, Northwest Passage and the board that makes the agreement. I was just trying to look at the first year they went to the 6th bed. That would have been 2019.
Because essentially, they opened up a business and the county was the cash cow to flow, to keep them floating. That's the way I'm looking at it right now. So then, if
Well,
we have a place there, okay?
Can I
Go
give
ahead.
input? So the bed guarantee is intended to be kind of payer of last resort. So it's not intended to be, okay, we're just gonna let these empty beds float open. It's intended to be, you know, worst case scenario, we can't get any placements. It's intended to be, so it's intended to be in, like I said, like payer of a last resort.
Right.
So it's not intended to be just Sawyer County, like giving them money every month. That's not the intention behind it.
No, but
I just want to clarify.
right. It just, you're the bearer of the bad news, Brittany, and I don't want you
Right.
feeling that or I'm upset with you or
No, I
I'm
understand.
upset of the situation. So if we take we take a placement, okay, and they're from out of county, and if there is any emergency cost, who is that on? Us or the other county?
What type of emergency cost?
Anything for the person, if they need to go to Winnebago, or say if they're in the group home, they have an emergency cost, a medical,
So
anything like that, is that on the county, us?
all of their medical costs are covered by their MA. But emergency mental health would be covered by Sawyer County.
What a great deal for the other county. Hmm.
Where do we go from here?
Well, my vote would be, we do not renew the MOU.
Are we supposed to make a decision on these tonight? Tom?
Yeah, I think this was more informational. We don't need an action tonight. This was just to bring new light to the situation after we've thoroughly analyzed it. And so we put it on your plates. We'll come back with it. Obviously, the MOU runs till the end of the year, so Brittany has had discussions with their executive staff, just, you know, on where we're at and where they're at. So between now and then, I think, you know, we need to come to some conclusion on, do we want to continue this arrangement? If so, under what circumstances? And if not, what kind of time frame? Obviously, they've got, you know, staff there that, you know, we don't want to make nervous. If we still need them there if we're going to continue this service. So, you know, timing is somewhat important to get out of the arrangement if that's what you want to do. And if we want to continue, we certainly need to determine under what circumstances.
I also, the MOU is there, but we don't necessarily have to go all the way to the end of the year. There's a cost for each side.
There you go.
I was here when this was created. And this is very different than what I remember being told. I share some of Don's irritation with what I've learned here tonight. Somewhere along the lines, and I'm not pointing fingers on blaming anybody, although I did when I was on the board and previous people were presenting that information to us. I did ask hard questions. sometimes I didn't like the answer and told them so. But this has been quite a shock. I think at the very least, we need to put this on the agenda for next month. And if any staff people have ideas on how we can rectify this situation and continue to make it fly, because I agree with Lorraine, I doubt that the number that we are dealing with now, I doubt that there's only 2 juvenile delinquents in Sawyer County. That the program has been 100% successful and taking care of everybody. That's just, that can't be true.
I agree with you, Dale, and I remember the hard questions you asked, and it was supposed to be a neutral program
Yeah, absolutely.
because of the high cost of placement. And I am totally amazed at the figures we're seeing. My big question is, why are we not getting the referrals from courts and other places? Is it because of COVID? What happened in the last 3 years that the numbers, you know, and I'm just trying to find out the reasoning.
That's,
Do you have any idea?
we don't really have an answer. When I met with Passage, we both kind of had that question. You know, and he just said the same thing. They anticipated such an influx of referrals coming in from everywhere, and it just never
Dried up.
happened. They never had the overflow of referrals that they anticipated having, and never really found like one county that was a steady stream of referrals. And they're working with their parent company, Northwest Passage, to they have like a specific like recruitment team for referrals to try to work through some stuff, but they haven't identified a specific cause. So
Yeah, I know we were at 8 beds and then we went to 6 to get outside counties to help defray the cost. And now we're almost at, well, we are at a loss. So it's not.
Well, we never used the 8. It was
I
actually,
know, I
it was,
know, yeah,
but we weren't filling the beds with Sawyer County residents, and then we
right,
agreed to take other county
right.
kids. Yeah.
Excuse me for a moment. Gail Olson, are you wanting to chime in here? Are you on?
I am, Mr. Chairman.
I didn't know that you were here, so, okay.
I hope you can hear me. I have to agree with Ms. Pettit and Ms. Pearson. And, you know, if I don't work, I don't get paid. And when we're looking at $40,000 a year for beds we don't fill, I'm sorry, that's unacceptable. I was there when that building was built. No, I hope before the next meeting, even though we are not voting on it tonight, before the next meeting, somebody sharpens their pencil and we figure out a better system for Sawyer County. Thank you.
Thank you. Tom, do you have anything to add at this point in time?
No, we'll have an agenda item again next month. Is there any other information or questions you have? Get them to Paul, and we can get those answered as well.
I got a quick question.
Oh,
Who is this?
Chuck.
sure.
Chuck, please go ahead.
Who sets the prices? Is that something that's state mandated or county mandated, or is there a way that we can increase what we charge people from out of county?
the daily rate is set by the state based on the services provided by the group home. So the more services they provide, they can request an increase in their daily rate, but it's set every, I think, 2 years by the state itself.
Okay, thank you.
Thank you.
Like I said, could we, I know we're gonna put this on next month's agenda. Could we give Brittany a directive that she renegotiate the empty bed number? And see if there's any movement with them, with Northwest Passage? Like coming back with maybe a 2 or 3 bed rate or something?
Well, I think that's kind of the discussion that she started. If we call the empty bed guarantee was what, 5 prior?
At one point it was 4, I believe, when they first opened, and then increased to 5 and then 6.
Yeah, and then within a couple years, anyway, it went from 5 to 6. And so that was a presentation made to this board and authorized to go to 6. So it, you know, the picture that we're seeing today, I think, is eye-opening for us as well as you guys. So it's, you know, I think we just need to digest it and then come back next month and see what we do. We can obviously bring back some other suggestions.
Right.
Brittany can meet with them again and just see, you know, what their thoughts are, because they, you know, they need to think about it too, whether they can continue, want to continue, that sort of thing. So.
Paul, did you have anything you wanted to add?
Oh, sir.
Joe?
I would just suggest that,
Please.
Can you come up to the microphone too?
I would just suggest that perhaps you go back and look at the stays that were unsuccessful by Sawyer County and see if there was anything that could have made them more successful. The ones that didn't stay there, that were put somewhere else where it cost the county more money. Because it's a program that we don't have, even though it's our building and we have some input, we don't have input. It's similar to like we do with transitions and Carroll staff. They can tell us we're going to discharge this client of yours. So you might want to see which ones were unsuccessful and what might have been done to make them successful.
You brought up an interesting fact. The county does own that building. Not trying to put the cart before the horse, but maybe it would be useful for some other purpose to Sawyer County that would perhaps benefit more Sawyer County residents than is happening now. John, what is the name of that? Okay, Don.
Pardon me?
Don?
Yeah. My, I know Tweed's saying 2 or 3, but if Brittany's gonna go negotiate, I would be negotiating on who we have there is billed. We're billed for, no more, no less. And if the building is suited, we own it, and we are in need of a mental health and a drug addiction someplace, maybe that's where we need to look and maybe set our sights, because we need something for the county.
Okay, thank you. Carol, did I interrupt you?
Yeah, I was just curious myself, the criteria for individuals to go into Oasis, has that changed since we started the program? Has it become more strict, more restrictive? That I can't understand why we don't have youth in there when I know that, like Lorraine said, many of them are coming through the court system every week.
I don't think the criteria has changed as much as, I mean, like I said, right now we have one there, and then we have one that, we have a lot more of our youth right now that are AODA focused. So like we have one right now that LCO is sending to treatment. And so we have a lot more treatment focused, which we can do in the community.
So maybe that's an idea, is look the criteria to substance abuse, mental health or something. We need to make the program good. Yeah, okay, thank you.
Okay, let's move on then to Child Protective Services.
You have a handout in there that's an up to date to the 2021 placements. We gave you last month, we gave you a 2020 summary. This is where we're at so far this year. And it's trending in a lot of the same areas, especially with the RCC costs. So, also, I talked to Carla, and there's a canned report you can get off the software system they use Cyrus one is going to be. They'll give you a summary of the caseload and a snapshot where you're at, a nice summary thing that I'll start including here on a regular basis, and these placement updates.
Youth Justice.
Just did that.
So economic support.
There's a report in there by Shauna, which you submitted.
Public health. Julia?
Yes. I'll start my video. Okay, and first off, we have drinking water, and are you able to bring that up, Alex?
Do you have something you want to share with it, or it's the link on that?
It's the link.
Oh, give me 1 second. All right.
Okay, so we have reviewed our drinking water fees for our lab testing, and we have seen some increases in UW Oshkosh that we are using, and you will see that we made some recommendations for some cost increases with some justifications that are in the yellow highlighted area. And one of the things that I just want to call out is on the very last section, we have Sawyer County staff to collect third-party well water samples. We've been getting more requests from VA and HUD loans to be able to do third-party testing, which means that we actually go in and collect the sample. Normally our water samples, people come in, they purchase the bottle and the test kit that they want. They go out, they get their water, and then they bring it back to us, and we can analyze some in our own lab and some we need to send out. And then with HUD and VA and some loans, they require third-party testing where we would actually go out and do the water testing. So that's a new testing fee that we're recommending for the real estate kit, and then it would cover our time and costs for travel. So that is one of the new ones on there. Most of them, we are not recommending any changes. You will see that we are actually recommending, and I'm hoping you're able to kind of follow this. We're recommending that we actually no longer just have nitrate alone because nobody is ordering that, nor is anybody ordering arsenic alone. The arsenic is in the homeowner's kit. And we mainly use a combo package of bacteria and nitrate. When we had it individually, it would have been a total of $50. So that's the recommendation that we're going with. So one of the things that we want to do with this program is make sure that it does cover its costs. My understanding is when this program came to light that it would be self-sufficient, and we wanted to bring this forward as soon as we recognize these increases. Open for any questions?
No, but I have a comment. Back when I owned the water well drilling company and we were doing water sampling, we did, what are the three biggies, the nitrates, the coliform bacteria. Anyway, we were charging $50 for that back in 2011. And nobody complained. So I think you're maybe a little cheap.
Well, and just to kind of respond, our goal is we do want people to be able to purchase and want to come in and do the well water testing, because that's important for us to be able to understand what's happening in our county. So we are trying to keep it reasonable from a county perspective to be able to move that forward.
No, I understand why you want to know the information, but these are places that have to be tested, right?
Mm-hmm. Some places need to be tested. They have the TN facilities, and we have included when we did our fee increases last year for our tourist rooming houses and other fee increases. We included some of the water sampling in there. A lot of this water sampling are things that we do want people to just, your own personal well and get it tested is one of the options. And then sometimes there is reasons why people do have to get tested, again, for getting loans and other selling houses, buying houses, that type of thing.
Yes, when a test is required.
Yes.
Otherwise, the DNR does a good job of trying to educate the public to get their wells, private water wells,
Correct.
tested locally as well.
Right, and we work directly with that program.
And Julia, didn't we take over this process or doing these labs because we wanted to be an agent of the state and do a better job than the state could do because we live here and we know where these places are. So do you agree that this has been beneficial to the county?
Yes, we have a lot of people that are very happy to be able to come in and easily pick up a kit and be able to move forward and have somebody to call to be able to talk to, ask questions with, to go out. We'll do a home visit if we need to, walk people through it. So Brian and Matt do an excellent job, and we usually have an intern in there in the summer that also helps to make sure that we get everything done timely.
Thank you.
I have a question for Dale.
Okay, go ahead, Mr. Olson.
Yeah, as I remember, we actually kind of started all this with the tourist rooming houses. That was kind of the impetus for us starting our own water testing, because tourist rooming houses, we wanted to make sure they had their water tested before they had guests come, for high nitrates and other things, fecal coliforms. That was the impetus behind starting it. But I think they've really taken off. And I agree with Mr. Schlueter that I think the price is incredibly reasonable.
I don't know if that is, we need to raise them or if we can stay with what we're recommending. So I will leave it to the board now to decide where we want to go from here.
Anybody have any questions? I have one. How is your budget coming? Are you breaking even, making a little money? Where are you at fiscally?
We should be covering our costs, maybe even coming a little bit ahead. Last year was a little bit of a different year for us, but in the long run, everything is coming out good. I'd like to see where things land this year to make sure that those fee increases that we had done last year and with making sure we have this coverage to see where we land. There has been, last year was an unusual year, not just because of COVID and kind of our attention's being just put on the disease itself. There was a lot of buying and selling that was happening in a lot of new tourist rooming houses. So we really need to kind of see where we land after another year of this. And but right now things are looking good.
Have a recommendation in mind?
Was that a question for me? Because I did not hear you.
Yes, I'm sorry. Do you have a recommendation in mind?
The recommendation would be to move forward with the charges that we are recommending moving forward with that are noted on the fee schedule. I don't know if Alex was able to bring that up so that you guys could see that.
Well, it's up there, but I can't read it from here.
Okay, do you want me to read it? I can read it out loud with where we are at if you'd like me to do that.
Well, we can. It's on our iPads.
Okay.
So do you need a motion then, Mr. Chairman, to approve this? and send it
There is a
on?
resolution that explains it.
Okay. Okay, well, I'll make a motion then, Chairman, that we approve or send this resolution authorizing increase in drinking water test fees, that we approve it and send it on to county board.
Do we have a first and a second? Motion and a second, I should say. Any other questions, comments? The resolution, is this a simple vote or is this 2/3?
It's a simple vote,
Okay,
simple majority.
everybody in favor, say aye.
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 Thank you. Anybody opposed, say the same side. Okay, motion, resolution passed.
Okay. And I will move right in then to the COVID update. Do a share screen here. And here we go. So COVID update for April 13th, 2021. One of the things that I wanted to cover is for the state of Wisconsin, we are still at the orange risk level. That is at 15.4 cases per 100,000 per day. And so the average coming in is close to 900. What I wanted to just show everybody is the map here. You can see that we're looking fairly good in Wisconsin, but we're surrounded by a lot of red risk level areas. And so I just want to make sure that everybody is aware that this is what's happening around us. And there is quite a bit of travel that goes back and forth. And we've been seeing Minnesota, it started kind of in the middle of the state and it's kind of seeping in towards the western part of our borders. So just want everybody to be aware of that.
Julia?
Yes.
Sorry, this is Sabrina Dunlap.
Yes.
Apparently, St. Mary's was on divert as well as the cities this past week. So we're seeing it not just red in the counties, but also very relevantly, the hospitals are filling up again. You probably know that, but.
Yeah, that's a very good point to bring forward. And especially where we would be sending our patients to is where those risk levels are definitely high. For our county ourselves, we are still in the orange. We are at 10.4 per 100,000, and it's about a 1.7 positive cases per day. We still do have testing available through the curbside testing. When you go onto our website, the phone numbers are there. All the testing locations. We do have testing also available down in Winter and in Iron River through the National Guard, and that will be through May. We're doing well with our vaccination rates. The vaccination rate is at 37.5%. So that's 6,216 residents of Sawyer County have received at least one dose of vaccine. And what is really wonderful for us to see is the 65 plus. This, as you recall, was the highest area of risk when it came to death and to hospitalization. And we are at 74 or close to 74% being vaccinated. The other thing I wanted to share with you is that Lorraine kind of alluded to this, is that we are working very closely with LCO on getting vaccines out to our communities. In the past, we have been working with the hospital. They've been ordering vaccine, we've been ordering vaccine, and we've been able to have clinics where we're serving upwards of 450 to 500 people. However, we are not having as much vaccine coming into our community at this time. However, LCO has received quite a few shipments through the federal government and IHS, and they have been now moving this out to our communities. So as you recall, LCO helped us to vaccinate the Hayward School District, and now they are moving forward in helping us with a large vaccine clinic that we will actually be hosting at Hayward High School Gym. That'll be on the 16th, this Friday, from 10 to 6 p.m. That'll be for everybody 16 and older. There's no appointments. People can come and sign up, or can just come and get vaccinated. We have over 1,000 doses of vaccine. So we would hope that we could give all of that vaccine, but we are prepared to be able to vaccinate about 150 per hour. So the wait shouldn't be too long. And then if this doesn't work out for people because it is a no appointment type of a situation, LCO is also having another vaccine clinic that's open to all communities. And that is by appointment, and you'll see that alongside. We have all of this information on our website, and we are posting them through Facebook, so everybody is able to get the information they need. The other thing is there is paperwork that can be printed ahead of time, so that saves time when you come into the clinic. And these will be Pfizer vaccines, so they are available for 16 and older. And does anybody have any questions on vaccines before I move on to my last slide?
No, go ahead.
Okay, and just the last slide is we need to start thinking about recovery. Well, actually, I did miss a piece that I did want to talk to you about vaccines. Paul had mentioned this. We are working with Lori Perlick and the ADRC to be able to identify those residents that are homebound or having difficulties getting into vaccine clinics, and we're going to be working with them to make connections to make sure that everybody who wants a vaccine can get vaccinated. So that's really where we're feeling that the need is, from a public health perspective, is to look at that health equity issue. And then moving into, once we're getting beyond the vaccines, we do need to start considering what does recovery look like for us. 3 years ago, we connected with the hospital to do a community health assessment. Public health is required to do one every 5 years. Community hospitals are required to do one every 3 years. We are going to stay on the every 3-year timeline with the hospital. We've been looking at the survey, and the hospital is ready to be able to start getting this out, and we will assist with that. So the community assessment will go out, the survey will go out April 15th through May 20th. And what's important about this, and why I think it's very timely, is that we've all been talking about the changes that COVID has had on our communities in our county. And this will give us an opportunity to validate and or find new areas that our community feels that we need to be focused in on. So this is going to be really, really important this year to make sure that we're very focused as we move forward. That is it. Anybody have any questions for me?
Doesn't look like it. Thank you very much. You
Thank you.
Yeah.
doing a great job.
Thanks, Lou.
Okay, fiscal budget performance report. Questions? Okay, future. That includes the budget performance report. Purchase services recap. 2000 now. Any questions on that? Okay, future agenda items. I think we're gonna have a full agenda next month. Is there anything here, people? Other matters for discussion on that? We're adjourned.
Thank you.
Thank you.